Hello everyone. The Government of India has once again reiterated today that all citizens will get at least one dose of the vaccine before the year runs out. Will this include children as well? What is the plan on vaccinating children? Do we even have a vaccine to inoculate them with? These are questions with which a 12-year-old girl in Delhi has moved the Delhi High Court. Tia Gupta's petition is seeking the immediate vaccination of children between the ages of 12 and 17, and she wants to know why the Government of India does not have a national plan to protect children from COVID-19. Dr. Devi Shetty, one of India's most respected doctors, has already warned that the third wave could be brutal for children below the age of 12. So can we really afford to delay vaccination for children and yet talk about holding board exams or sending them back to school? Also on the show today, we are looking at what COVID-19 is doing to children in urban slums and marginalized sections. We have the CEO of Save the Children, Sudarshan, talking to us. Also joining him is actor Huma Qureshi. She's talking to us about the ones that we are leaving behind. India has 165 million children, and these are children below the age of 12. And one of them has taken the Delhi government and the central government to court with the question, why are you not vaccinating us? Tia Gupta and her mother, also her lawyer, Neoma Gupta, joining us on the show today. Dr. Joseph Brito is a pediatrician, someone with a vast experience in pediatric ICUs. He's joining us as well. Tia, I'm coming to you first, not because you're the youngest person on our panel today, but also because you are the one who has taken the Delhi government and the central government to court. Why do you want to be vaccinated? What is the hurry?
I want to be vaccinated because I've seen so many of my friends suffer anxiety because of COVID, going into quarantine, suffering through mental health. And I'm just like thinking here, we should be going to school in the real world, not online. We should be worrying about exam pressures and going into friends groups, not about how this vaccine is affecting us and our parents.
So what are you really expecting from this petition? I'm asking you this question because right now, the Government of India could very well turn around and say, look, Tia, we really want to vaccinate you. But the fact is we don't have a vaccine right now that is ready for children. Pfizer-BioNTech is doing its trials on children, but uska result kab aayega, we don't know, maybe by the end of the year. So what will you say to that when they say ki we don't have vaccines for children?
I will say that throughout this past year, I don't think anybody's acknowledged us or our need for the vaccine. They should have started it earlier. They should have definitely started it earlier. But now, since we are bringing this topic up so late, they should at least, I think they should give us some acknowledgement. They should be more open about the vaccine trials. They should tell us where they are, which stages they are, and they should also be give us like tips about mental health and all, because so many children are suffering.
Okay. Naomi, can I just bring you in here? I want to ask you what prompted this petition. And in the petition, you're not just talking about, having a national plan for inoculating children, but also inoculating their parents, which means young parents. Tell us about why you had that clause in as well.
Okay, so as you know, the second wave affected a lot of children, and it did affect, suddenly, first it was only adults, now it affected children. There were a lot of children who were orphaned. There were a lot of, actually, we know a couple of families who lost children within this ecosystem. So it's obviously a bubble. It is affecting both sides, whether you're an adult or a child. So it has to be a cohesive unit. So the protection has to be for either. Earlier, the pressure for kids was not so much last year because there was not so many cases of children becoming patients. But with the second wave, the flow was scary. And this fear, and also Tia and my younger daughter constantly telling me, Mom, we want to go back to normal school. Yes, the virtual platform was a fantastic interim relief, but we now need to move a little faster on this process. There were not many answers in the newspapers, which I could answer to them, because usually we are able to give answers to our children because everybody is so tech savvy and aware. There was not enough information. Also, another point was there were a lot of children they know of who are studying abroad, who are having a normal life. So, that if you're putting India on a global platform, then put India's future also ahead of you now. The children are the future. Agar unko you're not giving importance, what's the whole functioning of the system.
But Naomi, does it not worry you as a parent that there's right now only one vaccine that has been approved for children in the United States and America? You know that, that's Pfizer for children
Of
12
course
and
it
above.
worries.
So no, but I'm asking,
course it
what,
worries.
my question was this: does it not worry you that that trials have not been conducted in India? That we don't know if these, even if we were to get the Pfizer vaccine here in India for the kids, there are no trials. Does it not worry you that कुछ गड़बड़ हो जाए तो? Are we
No,
rushing
see,
it?
a company like Pfizer, who's introduced the vaccines abroad in Canada and America specifically, they're a responsible company and come with a huge set of rules and protocols which they must have followed. So if Indian markets get open to them, it is the parents' decision which vaccination to get. But at least give us options. What I take for my child or you take for your child is our personal discretion, but give us options. Give us some roadmap. I'm sure people who are getting the children vaccinated abroad are not going to be doing it with half awareness. They must be doing it with full awareness.
Dr. Brito, just come in here. Are trials required on Indian children before, say, a company like Pfizer can come in? Bharat-BioNTech is telling us that their trials are underway. The government of India has given them approval for their trials, but the vaccine will not be ready this year at least, which means that children will have to wait till the end of this year, at least for Bharat-BioNTech. Till then, is Pfizer a vaccine which can be brought into India to inoculate children here in India, or will we be rushing things without a trial?
Shreya, thank you. Thank you for inviting me onto your show. But before I answer your question specifically, I want to congratulate Tia. It's really impressive. A 12-year-old who is so brave, so confident, and who is standing up for something that she believes in. I wish Tia and you more 12-year-old children like you. So,
Thank you, sir. Thank you so much.
Joseph. So Tia, I don't think children should be vaccinated just yet. And here are my reasons why. Please hear me. The reasons why we vaccinate people, adults and children, is first, we want to decrease the severity of infection when they do come across the infection. And we want to prevent hospitalization. And the second is we want to decrease transmission. Currently, there is no data available, as has been said on this program, available for the two vaccines that we are administering in our country. You have to bear in mind that the burden of disease in children is low. Children will be impacted in the next waves, but I believe, and the data suggest, that they're not going to be impacted disproportionately. In the United States, where epidemiological data is available, the burden of disease in children, which means children requiring hospitalization, just 2% of the positive cases in children end up requiring hospitalization. And even less, 0.03, that's 3 out of 1,000 Tia. 3 out of 1,000 children will require intensive care and have worse outcomes. So you have to bear in mind, when we start looking for a robust vaccine for children, we have to bear in mind the burden of disease that we are trying to prevent with vaccination. You also have to bear in mind that transmission takes place not from child to child, not from child to adult, but from adult to child. So the vast majority of cases, transmission. So what we can do for a start to keep our children safe is first decrease the number of cases in the community. Second, vaccinate all the adults around you, like the parents and grandparents in your home, and like the teachers in school. So let's vaccinate the adults, because that's where children are going to get infected for.
Okay.
There is no justification. I'll just finish one last point. There is no justification today to start vaccinating children in the absence of robust and rigorous clinical trials, because we are talking of largely healthy children. You also asked
Yes.
the question about the Pfizer-Moderna vaccine, which is available in the United States. When that vaccine is available in India, and there are indications, VK Paul of Niti Aayog suggested that the Pfizer-Moderna vaccine is likely to be available in India in July, and they are likely to waive any bridging trials. These are trials that will are often done in the local country, which they are likely to be waived. But bear in mind, the messenger RNA vaccine, which is the Pfizer-BioNTech vaccine, has undergone trials in the 12 and above age group, which is why children are being vaccinated there with that vaccine.
Okay.
What we need to do is to wait for those robust trials to take place here for the vaccines that are currently available.
Okay.
Shreya.
So, Tia, you can have the last word. Since you started the show, you can have the last word. The doctor here is saying that, look, right now there is no data to suggest that kids are falling very ill because of this virus, and let's not rush things. Would you agree with that? Because, you know, so far data seems to suggest that COVID-19 has more or less spared children. At least it has not put children in hospital. Does that give you some degree of confidence?
I would say that when we filed the petition, I was not expecting an immediate effect, like a reaction from the government. Nor was I expecting like vaccines here right now. No. So, and also the third wave, which the media indicates that the third wave will only affect children, if I'm correct. And this has caused a major phobia. And also children may not be getting hospitalized, but their mental health is getting. Most of my friends are suffering through anxiety, which I cannot watch anymore.
All right. Okay, Tia, thank you very much and all the best for your petition. Naomi, thank you very much for joining. Thank you so much. And Dr. Brito, thank you very much for joining us as well.
Thank you, Dr. Brito.
Now, currently, we have no vaccines for children in India. We've bought that out. And if we depend only on Bharat-BioNTech, that has got clearance to conduct trials on children, then we will have to wait till the end of the year. There are demands by the likes of Arvind Kejriwal to import the Pfizer vaccine for children on an emergency basis. It is right now the only vaccine, by the way, in the world that has been cleared for the 12+ age group. Here's a quick look at all major vaccines and where their trials on kids have reached so far.
Vaccinating kids has become the next big focus for India, as fear of the third wave looms large. Bharat-BioNTech is already in the process of starting pediatric trials of Covaxin for children, aged 2 and above. Which means a vaccine for kids from their stable is still at least 6 months away.
Most vaccinologists feel that the vaccines should be safe in children and we should get the trials done quickly. So hopefully in the next 3-4 months, we will have vaccines which will be approved for children.
Serum Institute, whose Covishield contributes 90% of vaccines to India's inoculation program, is also likely to get the permission to start clinical trial of its Novavax vaccine on children. Vaccines for children is an area where India is treading very carefully. And there is reason for it. First, there is limited data or studies of pediatric trials. And second, the World Health Organization hasn't been very vocal because the number of children falling ill has been less compared to adults.
WHO ने अभी कोई रिकमेंडेशन नहीं दिया कि इन जनरल पीडियाट्रिक पॉपुलेशन को आप कवर करें. उसकी वजह ये है कि पीडियाट्रिक पॉपुलेशन में जब इलनेस होती है तो वो इलनेस वेरी वेरी माइल्ड होती है, हार्डली एनी डेथ होती है, नेग्लिजिबल डेथ होती है. तो अगर हम डेथ की पैराडाइम पे जाएं एज अ पब्लिक हेल्थ ऑब्जेक्टिव, सो ये लोअर प्रायोरिटी पे चलता है और एसिम्प्टोमेटिक होता है, बच्चों को पता भी नहीं होता.
Pfizer is the first vaccine to get the thumbs up for kids. It has been approved by Canada and the US for children in the age group of 12 to 15. Germany is also in the process of approving Pfizer. Pfizer has told India that its vaccine for the 12+ population is ready and has sought fast-tracking of approval. All other major vaccine makers are currently in the process of testing their vaccines on kids. Moderna has claimed 93% efficacy in adolescents aged 12 to 17. It is also testing its vaccine in children as young as 6 months of age. Trials are also underway for Oxford AstraZeneca's vaccine for kids. So for the moment, the only vaccine available for children is Pfizer. The American pharma giant is in talks with the government over a possible rollout of 5 crore doses between July and October. But there is a hiccup. Pfizer wants protection from compensation claims in case of an adverse event. With Swastika Das, Anisya Kumar for CNN News 18.
As we talk about vaccinating kids, COVID isn't really the great equalizer we often make it out to be. Up next, we are talking about how it is impacting children in urban slums and rural areas. Do stay with us. Actor Huma Qureshi is joining us up next as well. Is COVID the great equalizer it is often made out to be? Not really. In fact, not at all. Go to any slum near you or even settlements from where your house help comes, and you will know that COVID has only intensified existing social inequalities. They are the ones we are leaving behind. The children who forget having any access to online education don't even have access to enough and proper nutrition. I want all of you to give me just 7 minutes of your time to listen to what Sudarshan Suchi, who's the CEO of Save the Children Foundation, has to say. Actor Huma Qureshi is working with Save the Children, and she's working with them to help set up a 100-bed facility. She's joining us on the broadcast as well. Sudarshanji, I want to come to you first. What is it that all of us should know about the children we are leaving behind? Here we are sitting in Delhi talking about inoculating and vaccinating children, but there is the other side of children who forget having, vaccination, don't even have proper nutrition thanks to COVID right now.
So the biggest worry for the children is not merely from COVID itself, but COVID hitting the caregivers. So when we are talking about the vulnerable in the community, we are talking about those who are living on hand-to-mouth conditions, who depend every day for the next day's meals and conditions. So the way children have got hit is threefold. First of all, we are talking that the moment any of the caregivers get hit and are not able to reach hospital, home quarantine is a nightmare. For a 6 foot by 5 foot home being shared by 6 people, to be asking an adult to have home quarantine. I mean, I'm recalling the story of Priyanka from Kolkata, whose father got tested, had to be home quarantined. The only solution was rest of the 5 people had to move outside and stay out of their shanty. And the entire family got ostracized in terms of not accessing the community services, etc. That's the first whammy. Second part is the moment the livelihood is lost, daily food becomes a hit. And that has been the second major vulnerability of the children. Third, and far more equally serious, has been for lack of access to school, and Anganwadis has deprived them of that one assured quality meal which came by way of midday meals. And in addition, the free play and the free secure space that the schools and all offered, instead one has to be confined into home spaces, which has led to increase in child abuse, it has led to increase in mental stress. All this without the child getting actually hit by COVID. And when they do get by COVID, access to doctors, medicines, post-medical care, all that is a big question mark.
Huma, can I ask you why you decided to reach out to Save the Children? Was there an immediate trigger, something particular that happened?
Everything. The past few months, weeks have been very, very terrible. We all have been going through almost like a collective anxiety about the situation in the country and this deadly second wave. Just the horrific visuals on television, on news. Personally, people around me, my friends, colleagues, co-workers, everyone it sort of felt as if everyone had fallen sick and one was sort of just left scrambling, and I know how much issues I had towards trying to help people or get them a hospital bed or connect them with a doctor, educate myself about what really one had to do in a situation like that. So I felt extremely helpless and angry and anxious. So जब ये मेरे साथ personally हुआ, and of course one took to social media, and anyone who's been following sort of realized that I was just trying to connect people or help not just my family and friends but other people as well who I could reach out to. And then there came a point in time where I was like, yeah, is it enough what I'm doing? Can I do more? Save the Children is an organization, of course. It's a 100-year-old organization, and I've been associated with them in the past. And about a couple of years ago, I had traveled with some of their board members and trustees, some friends of mine, to Nepal, and I saw the on-ground work that they were doing over there, how they had adopted these villages and the work they were doing with children over there. And it really, really moved me, because it felt like, they were actually making an on-ground difference. So जब ये pandemic situation हुई, तो I spoke to them and I was like, what can we do about it? What can be done? And of course, because मुझे बहुत सारे calls आते थे लोगों के कि अरे एक बच्चा है, and both his parents have passed away, he's home alone, nobody's taking him in, neighbors are scared because they feel like he could have COVID and they didn't want to risk their own families. What can we do? And I still remember calling up the Save the Children team and sending those details, the address and the number, and within an hour they sent someone to rescue the child. He was placed with the neighbors and help reach the right place. So जब ये सब हुआ, I was like, what can we do? Because these are very large concerns, और ये ऐसा नहीं है कि मतलब numbers कम हो गए तो ये जो problems हैं, जो devastation कोरोना छोड़ के जाएगा, what are we going to do about that?
Sudarshan ji, can I quickly come and ask you this? Do we have any data on how many kids in urban slums or rural areas have been impacted by COVID-19, both in terms of infection and otherwise as well? We have some data from the Karnataka government that is telling us that about 140,000 children below the age of 18 have been infected with coronavirus, but I don't think we have, a nationwide data as it were. Would you have anything? Could you throw some light on it?
No. Sadly, in this particular pandemic, paucity of data has been one of the severe crunch. Not just government data, but in the context of social distancing and lockdown, even our own access of free movement within communities and all has been fairly constrained. So data has surely fallen short, but empirical evidence shows that it hasn't spared anybody, and the impact is deep and wide, and the impact is far more formidable and just emerging from the rural context. And but the numbers haven't come forward yet. I mean, we're still kind of short of actual numbers.
Huma, can I then quickly ask you what it is that you're really looking to do? I believe there's a 100-bed hospital plan in the works.
So many. Number one, of course, like I said, now so many things you get to know when we were trying to help people through social media, and I just want to take a moment to talk about that. We often talk about social media being disruptive or whatever. I know myself and so many of my colleagues, have taken to social media to help people and connect them with either resources. I know somebody I was able to help get a bed in Agra, a 70-plus-old man who was very, very critical. Oxygen levels were falling, was not able to get a bed, and somebody just connected with me, a local level MLA, and helped us get a bed, and we were just able to save a person's life. He's now COVID-free and will be coming back home soon. So I feel like this is actually what started off the conversation, and we were talking about like, okay, what happens to children at a point like this? Because all studies tell us, and even common sense tells us, that children are the most affected in a time like this, and they're extremely vulnerable. There could be cases where either one or both of their parents have passed away. Where do these kids go then? What happens to their future? What happens to their education? What happens to their basic immediate safety concerns? And of course, like, there are conversations, and a lot of people right now are feeling very emotional and they want to, adopt children. But I mean, again, through my conversation with Save the Children, a lot of like practical things came forward saying, of course, there's a lot of good intention, but how do we channelize that? Because what we don't want is a situation to arise where a lot of children go missing. Or, God forbid.
Okay, I'm running out of time, Huma, but thank you very much for joining us. I'm going to thank Sudarshan ji for joining us as well. With that, it's a wrap from me. Thanks very much for watching.